It's a genital, it says genital human papillomavirus, but it's a human papillomavirus, which is a DNA virus that affects multiple organ systems in your body. There are over 100 different types of this virus, and it's common, it's so common that mostly 3 to 5 out of 4 people will actually be affected by this point at some point in their lives. That's a lot of people, and worldwide it's expanding even more. HPV is the most common viral infection in the world, especially in the anal genital tract. Lifetime risk for acquiring the disease is about as high as 70%. So that's 7 in 10 people will have exposure or infection with HPV. Most go away on their own. That's about 70% will go away on their own, but the 30% is what we have to worry about. So when you figure that that's so many people, 70% of the people in the world will have exposure to it, that's a huge amount of people that you have to worry about, even if you say 30%. So that's a greater number of people we have to screen. These lesions, precancerous lesions of the genital tract, the upper respiratory tract, as well as certain cancers in the vaginal area, the penile area, the rectal, anal, and oral pharynx. And those are come in contact with oral sex, anal sex, and as well as common heterosexual intercourse. Most commonly, cervical cancer is what we find the most. And many of these cancers can be prevented by vaccination, which is with Gardasil or some other variety of vaccine. Some types of the HPV virus can cause warts. People have seen warts on people have them on their finger, their feet, and even on the genital area. And you'll see some pictures for that. The ones on your feet are called plantar warts. You can get them on the soles of your feet. You can get them on the palms of your hand, on your finger. That's still the same virus. It's not the one that causes cancer. However, it does cause lesions, skin lesions on your body. There are 40 types of HPV virus that can infect the genital, vulva, vaginal, cervical, rectal, anal, and penile area. Those are the more common ones that are associated with sexually transmitted diseases or cervical precancerous or cancerous lesions. And we'll talk about the vaccines a little bit later. These types are sexually transmitted through vaginal, anal, and oral sex, or sometimes just skin-to-skin contact with a directly affected person. The problem with HPV virus is that most people don't display any symptoms. It's not like they're going to be sick. They're not going to have any outward symptoms until you just have a full-blown infection. So you can't say this person has it. You can't look at that person and say that they have HPV because they look just like you or me. Certain types of HPV in the genital area can cause genital warts. Those are the more low risk. When we say low risk, those are the ones that are not likely to cause cancer, but they are going to cause something else, which is warts. Cell changes that lead to cervical or vaginal or penile changes in cancers are considered the high risk. So we break them down into low risk and high risk, but we test for them when you do your pap smear, or when we test for people who have risk for anal cancer, we still swab and do the HPV testing for those areas as well. You can even, and you can also get penile cancer, so they swab and test that too. So it's not a pap smear, but it's the same principle behind collecting cells off of a particular area, putting it in a liquid medium, and then sending it through a computer-generated screen to screen those cells and for the typing for HPV. And most of HPV has no sequelae. It has no adverse outcome because, again, 70% of your time, your body will take care of it. It's the 30% we worry about. Most HPV infections will go away in 8 to 13 months after exposure, but some will not. Those are the ones that we see the most. Those are the ones that people, when we test them, they'll have an abnormal pap smear. We used to do, back about 10 years ago, we used to do pap smears on young girls, even at 15, 16 years of age. And if they had abnormal pap smear, we would do a COPO, which is a biopsy, and we would go on and even do LEEPs, or cold knife cones, which would remove certain parts of their cervix. But over the years, we found out that those young women, even though they're having exposure because we're having sex at a younger age and unprotected, those patients were not likely to develop cervical cancer because their tissues were so young. But we do know that by the age of 21, especially the earlier they end up with sexual intercourse, they're more likely to have an abnormal pap smear or have cervical cancer, but if they have HPV exposure. So that's where it's so important to get the Gardasil vaccine. So I'm kind of jumping ahead. But the vaccine is our best treatment outside of complete abstinence. And how many people remember that Fabergé commercial? You know, I told two friends and so on and so on, and how it multiplied. It was a shampoo commercial. Am I telling my age? Okay, anyway. Fabergé was this commercial where that girl would shampoo their hair, and the hair was so beautiful and bouncy, and they told two friends, and then they told two friends, and it would just grow, the screen would grow. I always think about that when you think about HPV exposure, because the guy that sleeps with 10 women brings those 10 women's exposure to the next person he sleeps with. Same thing with a woman. If she slept with 10 different guys, whatever he brought to the table, you bring to the table too. So it goes so on and so on. And while in the United States, we practice serial monogamy, meaning we go from one relationship to the next. And every time you have a new partner, it increases your risk of exposure. So most commonly sexually transmitted disease virus in the United States is HPV. Almost all sexually active men and women are infected with HPV at some point in their lives. Most, however, never know it. That means their body has taken, yes, sir? Did you have a question? Okay. Most common in people in their late teens and early 20s, and its highest prevalence is people under the age of 25. And as many as about 20 million people have a genital HPV infection in the United States. That's just the United States. That's not talking about worldwide. The things that put you at risk for HPV infection or as well as the problems associated with it are high-risk sexual behavior, again, multiple sexual partners, early onset of sexual intercourse. The average age of initiating intercourse in the United States now is between 10 and 11 years of age. So young ladies and young men are having sex younger and younger. So if you figure, that's why we started trying to give the Gardasil vaccine at between 9 and 11. That gives your body a chance to prevent the exposure. So if I can give you this vaccine before you have your initial intercourse, and then give your body a chance to respond to that vaccine, knowing that I need 6 months to give it, then I know that your body is able to absorb that virus and vaccine and protect you from the virus. We used to start trying to give it at 11, and when we realized that people were already having sex by the time they started the vaccine, we'd already missed an entire group of people. And those people, once they've been exposed to the virus, the high-risk ones, we've lost the opportunity to protect them. And just recently, we've been able to give it to young men as well. So and smoking also is a problem. If you smoke cigarettes or you even exposed to secondhand smoke, that puts you at risk. We also know that if you have more than 10 lifetime partners, and nowadays 10 lifetime partners is nothing. Most people have had, before they even reach 25, have had 10 or more by that time. If you start at 12 and you have a new boyfriend every year, you see how the numbers go up. So that increases your exposure for this as well as HIV. We discussed before the type of things that HPV-related illnesses, anal genital warts, cervical dysplasia. And dysplasia is when I do your pap smear and I get the results back, they'll tell me that you've been exposed either to HPV or you'll have these abnormal findings on your pap smear. We grade them, and those grades are how we determine how we're going to treat it. Some we monitor. Some we do procedures on. A colposcopy is where I take a microscope on wheels, put a solution on it, and look at your cervix and determine what areas are abnormal, and I do biopsies. If they remain abnormal, then I have to do something else, which is a leap or a cone, and take off a larger segment of your cervix. Because there's such a young population that's being exposed, we're trying to now protect their fertility, because you can take too much off and make them incompetent and unable to be able to have a child later in life without intervention. So those are things that we do to try to prevent people from getting cervical cancer or treat what we find as dysplasia. And again, there's cervical cancer, and we'll talk about the life expectancy and things like that. And squamous cell carcinomas, dysplasia of the penis, anus, vagina, and vulva area. That means the outside of the vagina, the outer area. And as I said, DNA of the HPV can be detected in tissues of the tonsillar area and of the mouth. So by engaging in oral sex with a person who's HPV infected, you can even get warts on your vocal cords. I've even had 2 patients that had to have laser therapy of their vocal cords to remove condyloma that kept recurring. And that, of course, that led to some vocal changes and other complications. Some of them can't even talk. And this is an example of a HPV virus on a person's tongue. That's what it looks like. That's a wart. Okay, so that's, come on. Okay, one of the most common sexually transmitted diseases is the anal genital wart. Individuals without obvious disease can transmit the infection, as I discussed. You don't have symptoms. Until you have a full-blown lesion, there's nothing for you to know that you have until you have it. That will also the basic way people will know they have an infection unless they get tested. And once you've been exposed, there's not much you can do. This is what the warts look like on the penile area. And this is what we've seen on people's vaginal area. So this is a woman with multiple condylomas, and what we do to treat either one of those on a man or a woman is we use a laser treatment. We use the laser because we can put them to sleep and then burn off that area, and then we burn the base of it to try to prevent the lesions from coming back in that specific area. We also have to wear a special mask so that the virus doesn't become airborne and then it gets in our nasal cavity, in our lungs, to cause infection. HPV infection is associated with a 4-fold risk of developing precancerous cervical changes. 48% of women develop evidence of HPV infection within 3 years of initiation of sexual activity. So that means, again, if you are having sexual intercourse younger and younger, you're ending up with more of an infection as well, a chance of getting this infection and having an abnormal pap smear later. For that reason, we stopped doing pap smears until the age of 21. Most infections clear spontaneously. That way we wouldn't have to do procedures and biopsies on younger women. And we saved it for waiting for 21, where if you started your age of intercourse earlier, we still wait because your body has a chance to take care of it on its own. If not, and it stays persistent, and we can know that most people don't end up with cervical cancer before the age of 21. It's very, very rare for that to happen. Okay, this is how the cervix will look in progression. This is normal. There's low grade, which I told you we have category. We have low grade, high grade, and then you have cervical cancer. The low grade, sometimes we can monitor that because, like I said, it can take up to 24 months for that to progress to anything significant. So we can not do a biopsy. We can monitor, depending on your age, monitor it if you're under the age of 30 and not do a biopsy. It depends on the grade. If it's low grade, you won't need a biopsy under the age of 30. If you're over the age of 30, we will do a biopsy. If your HPV type is high risk, we would do a biopsy even if you're under the age of 30, because that gives us indication that you have a higher risk of developing cervical cancer. And if you have high grade, of course, we're going to do biopsies and make sure that you don't have cervical cancer, because your risk is significantly increased. And the longer you have high risk virus on your cervix, you have an increased risk of developing actual cervical cancer. And cervical cancer is staged clinically. We stage it in the office, and we didn't do other testing for that. It's actually an avoidable cancer, and that is, once contracted, the relative risk of developing cancer is about 20 to 70%. Because your body, we don't know what your body will do with it, that's why the range is so wide for 20 to 70% of relative risk of developing cervical cancer. About 1% of women infected with high-risk HPV will go on to develop cervical cancer. But if you figure that 20 million people have been exposed to it, that 1% is a lot of people. And most cervical cancer is squamous cell. And I'm sure you don't want to know all about that because there's different types, but the ones we're fighting the most for is the most common, which is 70% of the cervical cancer, which is squamous. And HPV is associated with 99% of all cervical cancers worldwide. And the United States has done better because they've initiated pap smears back in 1955. Before 1955, our death from cervical cancer was way worse. It dropped by about 74% with the initiation of pap smears. So just by doing pap smears alone, we have prevented a lot of deaths. But in third world countries, they don't have access to that type of technology. Still to this day, there are people in other countries that do not get pap smears on a regular basis. So their death rate is way higher than ours, and their cervical cancer rates is also increasing. So you say in 2012, which is our most recent numbers we have, there were 12,042 women in the United States who were diagnosed with cervical cancer. 4,074 of those women died. So we have about between 4,000 and 5,000 women that die every year from cervical cancer, and that's not going down. And there are reasons for that. That could be lack of access to care, knowledge, not feeling that they should, because you feel fine, most people won't go to the doctor. But it's not about feeling fine, it's about prevention. So when you go, you want to be able to head off some things. And this disease is completely preventable. So this is an ethnic breakdown. The African Americans or black patients are more likely to have cervical cancer and die from cervical cancer. And you see white and Asian or Asian American are less likely to have it. They're on the lower end of the spectrum. Pacific Islanders and non-Hispanics are also more or less likely to get it. But African American, black, and Hispanics are more likely to get cervical cancer, and they have a higher death rate from it. This is the staging criteria in the 5-year survival rate. With most cancers, they talk about a 5-year survival rate. So you want to, by looking at this, you can see that if we catch it early, your chances of survival are so much better than if you catch it later. And that's by just getting a regular annual pap smear, or just going to have an exam. If you feel like your doctor's told you you don't need a pap smear, then you still should go get a pelvic exam to make sure everything is fine. Because HPV can affect the outside of the vagina as well, not just the inside of it. So you can just get a regular exam and have your vulvar area examined. So stage 0 is very early, very microscopic. You have a 93% survival rate. That means 7% are actually dying from even early stage cancer. And then it goes on from there with stage 4B, meaning 4B means that it's spread outside of the pelvis. It's actually in other organs away from the pelvis, and it's very advanced. Those people, 4A and 4B, have a very poor survival rate in 5 years. And this is what a normal cervix looks like on the left. Was my left? Yes, your left too. And a cancerous cervix on the right. Cervical cancer starts within the inside, what we call the transformation zone, that inner part right in the inside of the cervix. That's where it starts growing. That's why we get the cells deep within the cervical os. That's why we scrape for those cells, because that's where it's going to start. And then you see some changes on the outside as well. The vaccine protects against the major types of HPV. 2 types that cause 70% of cervical cancer are HPV virus 16 and 18. But there are other ones as well. Types 6 and 11 also cause genital warts. Now, genital warts, I showed you pictures of those. We can remove them, but they can also come back. Once they're in your system and they're in your DNA, they're there to stay. Sometimes your body can, prevent you from having further outbreaks, but there have been times, especially in people who are immunocompromised, like people who have lupus, who are on medications to suppress their immune system, or cancer patients, or even patients who are kidney transplant. They end up with a lot of these warts because their system is so suppressed they can't fight it off. Series of 3 shots given over 6 months is what we call Gardasil. Gardasil and Gardasil 9 is the newer one. It gives you protection for more than just the 4 that it usually does. The Gardasil original protect against 16, 18, 6, and 11, but Gardasil 9 protects against more than that. So it's covering a wider variety of HPV virus that causes more warts and more cervical cancer. And then you have Ceravax. Ceravax is out there, but I don't know that anybody pretty much gives it because it only covers for 2. Why give one that only covers for 2 when you got one that's been out there at the same time or before it that covers for 4? So even though Ceravax is out there, I'm not sure who's using it and in what country they're using it, because we almost all use Gardasil, and now with Gardasil 9, we'll be using that more often. As I stated, the FDA, these are the age ranges. We start, like I talked about before, we start at age 9 to try to give them. And the key age is age 11 to try to make sure every child we know has been exposed to the vaccine or initiated the vaccine series, at least by the age of 11. But you can give it for females in the US, between 9 and 26, and then for males, also between 9 and 26. The FDA has just approved the Gardasil 9 as for males between 9 and 12. What we originally started with about maybe 10 years ago giving the Gardasil vaccine. Remember, there was a big uproar. People didn't want to give it because they thought it was giving their daughter carte blanche to have sex, but when it really is not. You can have an easier chance of getting hepatitis, but we don't have a problem with giving hepatitis vaccine. But hepatitis is also sexually transmitted, but we give that vaccine at birth, and we should do the same thing, and we should think the same way about the Gardasil vaccine, because we're trying to protect a whole generation of young ladies and men from even being exposed to the virus to be able to fight it off and not die from cervical cancer, penile cancer, or have these warts. They can be very disfiguring, as you saw in the picture. When I'm lasering it off, I have to, it burns the skin, so I have to then make sure I follow it regularly to make sure those burns don't heal appropriately. And if the lesions become even bigger, and I've seen them take over the entire vaginal area, it requires reconstruction of the entire vaginal area. So prevention is our best option. Ceravax, as I stated, protects against 16 and 18. Not many people are giving it. Widespread vaccination with Ceravax or Gardasil has the potential to reduce cervical cancer incidence around the world as much as 2/3. With Gardasil 9, it can prevent even a higher proportion. In addition to the vaccine, can reduce the need for medical care, biopsies, invasive procedures, associated follow-ups with abnormal pap smears, as well as the cervical screening. So this, if we start giving it worldwide, it could actually change the focus of how we do women's health care. It could reduce all the biopsies we do, all the colposcopies we do, the risk of loss of fertility. It could change, and the loss of life more than anything. It could change healthcare significantly for women's health as well as men's health. All HPV vaccines have been studied very carefully and have been shown to save lives and not cause any safety concerns. They have side effects which would be mild feelings of discomfort, redness at the injection site, fever, dizziness, and some places some nausea. But very, very few people have any side effects from the vaccine. And if they have one, they don't have one after the second, by the second one, they don't have any reaction at all. None of the HPV vaccines protects against any other sexually transmitted disease, so you can't use it to protect against anything but HPV. And none of the vaccines protect against existing infections. So as I stated earlier in the talk, if you've already had sexual intercourse and you've already been exposed to the HPV virus, it's not going to protect you from anything that you've already been exposed to. It's already done. And then if you become sexually active soon after getting the injection, you still might not be protected because you have to give your body a chance to respond to the vaccine, and it has to take 6 months or the three injections to do so. Recommends especially for preteen girls age 11 to 12. And they also recommend that the boys get it at this age as well, but we're recommending that boys get it at this age, but it's not been officially stated by the American Cancer Society. However, we know that if we don't protect get the boys first, there's no point in giving it to the girls, because it's a point, but it works better if we do both of them together. If I can prevent this young man from carrying it around, then this young lady is even more protected. But so that's what we're focusing on now, making sure the young men are getting protected as well. It says HPV vaccine offers the best protection to girls and boys who receive 3 vaccine doses and have time to develop an immune response before they begin sexual activity, which I just said. This is not to say that preteens this is not to say that preteens should start having sex, but it's also just telling them that this is the best way we can protect you from getting cervical cancer. It is not a carte blanche to have sex at any way. It's only a way to try to save your lives. This vaccine can help prevent boys from getting infected with the types of HPV that can cause cancers of the mouth, the throat, the penis, the anus. So these are the things that only tools we have to prevent those type of infections and those type of diseases. Outside of abstinence, the Gardasil has been tested in women from the ages 27 to 45. I think they've got a 10-year span of tests going on, and no one has had a loss of protection, and no one has had any adverse outcome. They did not help people, as we stated, that already had an infection. Those people, there's nothing we could have done for them, but we could prevent them from getting other things like warts if they didn't already have exposure to the viruses like 6 and 11 that cause genital warts. Current research has a 6-year follow-up of data. They have not shown the vaccine's loss, but which I just said again. And most insurance now covers the vaccine. I haven't seen anyone whose insurance has not covered it unless their age is over the age of 26 or under the age of 9. And in the United States, too, the Vaccine for Children program provides vaccines for all children. So if you have a child, grandchild, or whatever, who has not had the vaccine, you can actually go to their pediatrician, even up to the age of 21, because most pediatricians aren't treating people past the age of 21. They can get the vaccine for free for the Vaccine for Children's program. So I urge you to make sure that they have this vaccine, because it's the only thing we have in our armamentary to help prevent cervical cancer or warts or genital anal cancer as well. And this is talking about the Vaccines for Children program. And there's a website with the CDC where you can go and talk about that as well. Are screenings still necessary? Oh, of course. We have to get annual screenings to protect and find out who has been exposed. Now, if you've had a hysterectomy for benign reasons, meaning that you didn't have an abnormal pap smear, you didn't have cervical cancer, then you don't necessarily have to have a pap smear. I do recommend patients come and get examined because I have had people have dysplasia of the vaginal cuff after hysterectomy. So I do screening for that as well. You can develop vaginal cancer. You can develop cancer of the vagina on the outside, the vulva. And men should also be examined regularly too, especially if they're uncircumcised. You cannot see a lesion if you're not, most people don't look, but if you're not looking at your partner and their partner is uncircumcised, you can actually have lesions inside the foreskin and you would never know. Though HPV vaccine prevents most types of HPV that cause cancer, there are still some types which cause approximately 30% of cervical cancer, which we already talked about as well. HPV vaccine is considered a major victory, but for me, I don't consider it a victory until everybody has gotten the vaccine and that we see even more of a reduction in the incidence of cervical cancer. We have seen a great reduction, but there are still groups that don't go get care and they have lost their window to get the free vaccine and they're also exposed. Again, we have to also work on our issue with how early women are having intercourse. I think that makes a big issue, that's a big difference in how we'll have an overall outcome. If our children are having sex younger and younger, how do we combat that and reduce the risk of disease for these young ladies later in life? I don't think they think long term about what the sequelae for that will be, but it has major ramifications for it. Again, routine cervical cancer screening with your gynecologist to detect the virus. And these some of your, and I had a video on here that I don't get to show you because it won't play. So, but this is an actress. Her name is Coda de Pablo. She was NCSI, excuse me. She's an actress that played on NCSI. She was Ziva. Anyway, she had an abnormal pap smear and she missed getting her pap smear done for several years, being busy, because women try to be superwoman and they try to take care of everybody else but themselves. And men do it too, but they, since I do women, that's what I can speak about most as women. And they don't go for years. They have their children and they say, I haven't had a pap smear in 10 years, and they'll come in and sometimes you'll end up with an abnormal pap smear. So if I can say one thing is to follow up and take care of yourself. Just once a year, just get everything checked, make a day where you get everything done, especially gentlemen too. You go and just make sure you have a day where you go get your annual exam, you get your mammogram, you get whatever testing you need to get. Just make that one day your health day and get it all out of the way. That way you won't have to worry about anything else happening, or you can prevent and extend your, prevent disease and extend your life by a lot. Does anyone have any questions?